Okay, Bismillahirrahmanirrahim. Now today we are going to discuss few important MCQs on histology. The topics are thymus. We are starting from thymus. A biopsy from anterior mediastinum in a child shows lobules with dark cortex, pale medulla, and Hassel's corpuscle. What is this organ? The options are lymph node, thymus, spleen, bone marrow, palatine tonsil, and the answer is thymus. Obviously, because I have already told you in my previous video, if you have seen my previous video, I have told you that whenever you see Hassel's corpuscle in the in any MCQ, you mark it by closing your eye on the thymus option. Hassel corpuscles are unique to thymus medulla. Question number 12 is in which lymphoid organ do lymphocytes undergo maturation and selection? The options are lymph node, thymus, spleen, Peyer's patch, tonsil. The answer is thymus because thymus is the primary site for T cell maturation. This question can be asked to you vice versa, as T cell maturation takes place in which organ? This is thymus. Okay, or the role of thymus is T cell maturation, or it can be asked to you in another way, but you should remember the BCQ in a vice versa manner. Question number 3 is a histopathologist examined a biopsy from a lymphoid organ. On microscopic study, he observed spherical whorl-like structures formed by concentrically arranged epithelial cells with flattened nuclei and eosinophilic cytoplasm located in the medulla. The specimen most likely belonged to a lymph node, palatine tonsil, pharyngeal tonsil, spleen, and thymus. The answer is thymus. Question number 14 is a 40-year-old woman with breast cancer developed enlarged firm bean-shaped structure in her axilla. Microscopically, these organs showed branching cords of lymphoid tissue separated by spaces that allow lymph to filter through. These spaces are known as germinal centers, lymphoid follicles, medullary sinuses, subscapular sinuses, trabecular sinuses. The answer is medullary sinuses. Question number 5 or 15 is a young child presents with recurrent infection and fever. Investigation revealed an immunodeficiency disease caused by decreased number and impaired function of T lymphocytes, which normally mature in the thymus. In a lymph node, these cells are primarily located in which organ? They are located in the paracortex. The options are cortical sinus, medulla, nodular cortex, paracortex, or subscapular sinus. T lymphocytes mature in the thymus and populate the paracortex of the lymph nodes. Nodular cortex contains B lymphocyte that can be asked to you in your another BCQ. Medulla has plasma cells, macrophages, and medullary cords or medullary sinuses. Subscapular and cortical sinuses rich filled channels, not rich in T cells. So the correct answer is D, which is paracortex. Another question is child's thymus biopsy shows dense cortex with lymphocytes and medulla containing Hassel's corpuscle. What is the function of the Hassel's corpuscle? Cytokine secretion for T cell differentiation. This is the function of Hassel's corpuscle, and which is the hallmark of the thymus, which we have already discussed. Another question is in elderly, thymus replaced by adipose tissue. What is this process? This process is involution. Okay, this process is known as involution. This is not atrophy, this is not hyperplasia, this is not metaplasia. Metaplasia is basically when one epithelium is converting into another type of epithelium, and atrophy is shrinkage of the size of the tissue, and hyperplasia is the enlargement of the size of the tissue. Now let's talk about the spleen. A splenic biopsy shows white pulp with central arteriole surrounded by periarteriolar lymphoid sheaths, pals. What cells dominate this sheath? Options are B lymphocytes, plasma cells, T lymphocytes, macrophages, NK cells. Answer is C, that is T lymphocytes. PALS is T cell rich. PALS is basically periarteriolar lymphoid sheath, which is rich in T cells. Follicles in white pulp are B cells rich. This can be asked to you in another question. Another question or another BCQ is a patient with splenomegaly undergoes splenectomy. Histology shows red pulp with splenic cords and venous sinusoids. What is the main function of this area? The options are T cell maturation, antibody production, fibration, filtration of old RBCs, hematopoiesis, lymph drainage. The answer is filtration of old RBCs. Reasoning is red pulp filters defective RBCs. Now let's talk about another question. There is a confusion also. In the spleen, T lymphocytes are predominantly located in which of the following region? The options are Billroth cord, marginal zone, PALS, periarterial lymphatic sheath, D red pulp, E splenic nodules. Here in few books I have found that the answer is red pulp, but few books says that the white pulp of the spleen contains lymphoid tissue around the central arteries. PALS rich in L lymphocytes, splenic nodules follicle rich in B lymphocytes. The marginal zone transition area containing antigen presenting cells. Red pulp and Billroth cords contain RBCs, macrophages, plasma cells and other immune cells but not T cell rich zones. So the correct answer is PALS. PALS is basically what? Periarteriolar arterial lymphatic sheaths. Biopsy of the but this need to be checked again, that which option is correct. Okay, biopsy of a spleen shows PALS around the central artery. Which lymphocytes predominate here? Obviously T cells predominate here because PALS around central arteries, they are rich in T lymphocytes. A splenic red pulp shows sinusoids and cords. Which function is correct? RBC storage and removal of old RBCs. There are the other options present which are not which cannot be possible in this scenario. That's it. Now follow for more such important BCQs. Subscribe the channel and to get the notification of the new video at the earliest. Thank you.